Hi, I'm Sonia Johnson. I'm a psychiatrist who does research and teaches at UCL, and I'm lead for the UKRI Loneliness and Social Isolation in Mental Health Network.
Yeah, so I'm Jackie Hardy. I've got lived experience of mental distress, and I'm part of the co-production group on the Loneliness and Social Isolation Network. Well, somebody myself with experience in loneliness and isolation, and I, during the pandemic myself, was um, locked in at home, and also I'd had a relationship breakdown, so that was doubly difficult. Um, And I think again, I know a lot of people, I certainly felt lonely and isolated, so that was very challenging. And I know lots of other people, either as part of the research we were doing, or again, even my sort of links that I've got with people with lived experience, I think there was a lot of feelings of fearfulness around even the virus.
We thought both in terms of our expertise and also in terms of the co-production groups we had access to, both the one in the Loneliness Network and in the Policy Research Unit, which we joined together with, that the best thing for us to do would be to focus on the mental health care system and on people already living with mental health conditions, and to look at what was happening there.
There were some challenges around receiving kind of support, especially if people need support from the mental health system. That seemed to be very slow to kind of respond, and in a lot of cases didn't kind of take to online or was late to take in online. And so I think a lot of people look to get support elsewhere, including myself. I turn more to charities, or you have mutual aid groups, or so there could be challenges early on, even getting food, medication, kind of getting support. And um, and I think, like, for me, I missed a lot of the face-to-face peer support groups, and I know that quite a few people that perhaps were involved in some of the interviews of the network, or even people that were in the co-production group, I think missed some of that. Being able to, and even being able to see each other. As a group, we used to see each other and get kind of support from each other. There was some good things, I think, come out of a lot of people develop their own kind of coping strategies. Might have turned to different things like mind groups. I certainly turned to, like, Ruby Wax, Frazzled Cafe online, and I certainly turned to that as getting peer support. And so I think, again, people found other ways perhaps to connect in.
It's exposed the social inequalities that were already present and that have a big impact on mental health, and has intensified them. So people who are living with mental health problems are often affected by other forms of inequality, like socioeconomic, related to ethnic background, migrant status, sexuality, and generally the COVID impact was greater on people who are already experiencing these things. So the need for societal change, really, as well as for community initiatives to address these inequalities and their consequences, is still greater and very relevant for mental health. I think the other things it shows were that we sometimes, even if there is greater social cohesion in response to it, as there was maybe in some neighbourhoods, it doesn't always include people who are living with severe conditions that may be stigmatised, or people who already tend to be marginalised. So I think while some people felt included by the sort of community coming together that Jackie's talking about, others really didn't. And so when you draw communities together, you need to think specifically about the sort of people who tend to be marginalised anyway, and what can be done for them. And then I think the final thing that's clear in the pandemic is the resilience that people with long-term mental health conditions often have, and the importance of the support they give each other, which, as again Jackie's already talked about. Well, we're doing our best to get our findings and get our work out of the kind of ivory tower and to more grassroots or policy levels in various ways. The Loneliness Network has links to quite a large number of charities and has had a variety of charities coming to our events or participating in some of the small projects that the Loneliness Network has commissioned. We've commissioned 11 small research studies which are intended to kickstart research in particular fields. And those are often at a really kind of grassroots level. So there's one with a therapeutic community garden, one with a community organisation that supports farmers. There's a community dance programme for young people. Those are all definitely getting out of the university. We're also working with policymakers, so some of us are on a DCMS supported group that's looking at tackling loneliness in policy. I mean, we're doing our best. I suppose as a researcher, you often don't really perceive impact very directly. You often can't very easily point to the exact thing that you did. I think we just do as we always do and keep trying to get our message across, but to decision makers and to other people who can make use of what we're doing. But you have to remember that people like, for instance, policymakers have quite a lot of different types of influence and different types of pressure. It's not just about what researchers say. So I guess we keep on trying, and at least now and then we feel there's a message that has got through. Absolutely. I mean, I've worked in applied research for a long time, and I'd say that trying to work with policymakers and people with lived experience and the voluntary sector and so on is what we would usually do. But certainly the network has given opportunities to do that at scale, really, and there's to have actually a decent resource that's not just for doing research, but that's dedicated to linking people together and also to kickstarting small-scale research on things by people who might normally not get much funding for the sort of community initiatives that might normally not be invested in really by any large-scale research. That's undoubtedly a great opportunity for both for impact now, but hopefully even more for future impact, because the networks are above all really about trying to kickstart things or trying to produce a kind of step change in what's going on in the field. And I think if we're successful, that will particularly be seen in future collaborations, future larger scale projects that hopefully will have their origins in our and other people's networks. The social determinants of mental health are so important that it seems we're not going to understand people in a holistic way unless we are interested and inquire about people's social situations, unless we value social interventions, which potentially are sort of relatively novel way of trying to improve prognosis for people with mental health conditions. It needs really a sort of wider approach that draws on community resources, that draws on other disciplines like the arts, people who think about built environment. And the thing that's uniquely challenging about trying to think about loneliness is the breadth of the perspective we're likely to need to take to come up with effective ways of addressing it.
I certainly think mental health services are not fit for purpose and need a big overhaul. And I'm a big believer and a champion around peer support, because that's made a big difference in my life. Peer support is still very much part of my life, and I'm thankful for that during this whole period. And I think a lot of people we sort of interviewed as well, got a lot of support from peer support and in different ways as well, when sometimes the mental health system kind of wasn't there.